Welcome and thank you for joining today's conference, Winter 2022-23 Update, Respiratory Disease Prevention. Please note that all audience audio connections will be muted until the Q&A portion of the call. Please open your chat panel by using the associated icon located at the bottom of your screen. If you need technical assistance, please send a chat and address the event services host. To ask a content-related question, please click the Q&A icon located at the bottom of the screen, type your question, and send. With that, I'll turn the call over to Bob Burns, Director of National Center for Health and Public Housing. Please go ahead.
Good day to everyone. Welcome to our webinar today. We'll be covering, as Marvin mentioned, Winter 2023 update on respiratory disease prevention, and specifically addressing COVID-19, flu, RSV, and preparedness for future outbreaks. Next slide, please. Okay, in terms of housekeeping issues, again, type your questions into the open field. And also, if you would like to be recognized and during the Q&A session would like to ask your question verbally, please feel free to do that as well. Also critical to our sessions is the ability to evaluate the outcomes. So next slide, please. At the end, we're just going to ask you a couple of evaluation questions, and they're fairly simple, just in terms of satisfaction. You know, you're satisfied with what you learned, kind of ranking on a 1 to 5 scale, with 5 being the highest. And the second question simply being whether or not you have confidence that you will be able to use some of the information learned today. And again, on a 1 to 5 scale, with 5 being the highest. And we will have that out to you at the end of the session. So please complete that. We would really appreciate it. It really helps us kind of justify what we do and also plan for future sessions. Next slide, please. Today, we're going to cover 3 or 4 topics here. And of course, we're doing our kickoff now, but we're going to get into the respiratory outbreaks, prevention, and preparedness. We're going to talk about planning for preparedness as we go along and how it fits into the context of emergency preparedness. Then we're going to have our good partners from CDC talk about COVID, flu, and RSV, surveillance and vaccine confidence. One of our great partners from the Administration for Children and Families will then talk about children and the impact of RSV and other viruses. Then we'll get into Q&A and we'll do closing evaluation and all that good stuff. So next slide, please. And just really one kind of simple polling question across the board, you know, for each of you. And basically it's about who you are. And we just want to see what kinds of folks are coming so we can kind of judge the needs of the audience. So who you are you a housing provider? Are you a health center, a government partner, federal, state, or local, a community-based organization, or other? So if you could complete that poll, that would be great. So Marvin, will they be completing the poll that we're seeing on the screen, or will they just be putting that in the chat?
Correct. You can go ahead and complete the poll that popped up on your screen and just make sure to hit the submit button when you're through.
All right, thank you very much. So we'll give you a couple of minutes to do that, or 1 minute to do that, I guess, and then we'll move on to the next item. All right, why don't we go to the next slide? Okay, and can you, I don't know, Marvin, if you can move the poll out of the way. Thank you very much. Okay, so again, I'm Bob Burns. I'm the Director of the National Center for Health and Public Housing. And with us today, we have some great speakers, Jason Amerhaji, from the Neighborhood and Community Investment Specialist at HUD, and kind of our great partner and a true health advocate for residents of public housing and other HUD-assisted families nationally, Richard Quarterone. And Richard has been a great friend to health and housing partnerships across the board. He's the acting communications team lead for the Immunization Services Division at the National Center for Infectious and Respiratory Diseases at CDC. And then we have Martha Okafor. Martha is a doctorate in medical anthropology, and she's a senior advisor to the Office of Early Childhood Development at the Administration for Children and Families. And she'll be talking about, in particular, about RSV and its impact on kids. Next slide, please. Again, we're the National Center for Health and Public Housing. We are trying to improve health outcomes for public housing residents and other HUD-assisted families through a combination of training and technical assistance, research and evaluation, and outreach and collaboration. We are also a grantee of the Health Resources and Services Administration to provide national training and technical assistance. Next slide, please. So we're really focused today, just to set a little bit of context or a frame, frame the issue a little bit, preparedness for infectious disease outbreaks. And of course, we've all been all too familiar with infectious disease outbreaks over the last couple of years with COVID. And now, again, we're being hit with, above average flu and RSV seasons. And we're going to talk about them in depth, and Richard Corderone from CDC will get into the particulars of that. But I just want to kind of talk about how this fits in terms of the overall of emergency management planning and the key of having made those plans, having those relationships, having communications and information sharing in place, focusing on maintaining financial viability and operational stability. All key parts of planning. And these are things that health centers have to do and housing agencies do as well. We know that, most of you out there have an emergency preparedness plan in place. And a critical part of it, as we've seen right now, is the involvement of partnerships between health and housing entities and other community-based organizations. And I'll talk about that in a little bit more depth in a minute. Next slide, please. In terms of partnerships, we have Healthy Together is a toolkit for housing and health collaboration, which we put together and issued last spring. And it gives you kind of a number of techniques and guides on how to reach out to the health center or housing agency near you. There's a link there to find it. You can also find it on our website at nchph.org in the resource library. And we're also very, very happy to have great input from Jason and the folks at HUD on the toolkit. So hopefully you will take advantage of that. Next slide, please. In terms of COVID and all that we've experienced in the last couple of years, there were some really, I think, important lessons learned in terms of the partnership piece and what it meant to emergency planning and the success of emergency, plan implementation. And the first is that partnership with the public housing agency or the health center or the Department of Health or the community-based organization. And within that context, the planning ahead is key, because a lot of great partnerships were formed for the first time during COVID, but a lot more really built on existing partnerships and really were honed and expanded during COVID. We saw the importance of for health centers to get from beyond the stethoscope, to meet people where they were, to deal with delivery of services curbside, door to door, virtually through telemedicine, to focus on underserved pops, particularly in public housing, elderly and disabled, to work on issues of trust and vaccine hesitancy. And it's always helpful if the first time you're reaching out to somebody, to partner on something is not in that emergency, because you want to have that trust and relationship built. Utilization of enabling services and mobile units and so on and so forth, coordinated. In some cases, housing agencies providing transportation, health centers providing clinicians and pop-up clinics. And throughout the entire enterprise, communication and flexibility across the board between the health center, the housing agencies, the community, and using all methods, virtual, paper, radio, TV, anything that works in the community, live events where possible, And then realizing that you have to cater to the residents and the community that you're dealing with. You got people who have jobs and childcare issues, but you want to keep a high profile and let people know you're out there. And also augment staffing with, universities and student nurses and other organizations and EMTs and so on. And the importance of in building that relationship and trying to, plan for, for those emergencies, build in the community health worker. There's a lot of funding out there now for community health workers across the board. And it is really key. And I do want to mention that in addition to Healthy Together, HUD also has a CHW toolkit, which they're going to be coming out with in the spring. And it can also be used to help you and guide you in establishing and involving community health workers, not just in emergency management, but also in chronic disease management. Next slide, please. I do want to mention too that in terms of your work and addressing COVID and trying to, COVID is still a national health emergency, though RSV and flu are not, but they're certainly, major health issues. But HRSA has just released about $350 million to health centers for the purposes of expanding COVID-19 vaccination, with the goal of increasing Americans receiving updated COVID-19 vaccines. And this also includes efforts on flu and childhood vaccines, because the relationship of those two issues is clear. And the period is really now. So it's December 1, 22 through May 31, 23. And so if you're talk to your health centers or your public housing agencies and try to partner on issues around expanding and increasing vaccination through a combination of education and outreach, and there's funding for vaccine administration and enabling services, which might be transportation, it might be daycare, whole thing, money for health center personnel, for health centers to expand hours of availability and site locations, also money for training of all kinds, and money for, as we were talking before, community partnerships, WIC and Head Start, of course, and other community-based organizations like housing and public housing agencies and those groups that offer food and deal with food security issues and employment and education and behavioral health services. So this is a major funding, and it's right now. So if you get a call from your health center and your housing agency, please jump in, or if not, reach out to your partners and maybe try to form that partnership. Next slide, please. Okay. At this point, I'm going to turn it over to Richard Corderone. And again, Richard is a great partner and been a great friend. And in terms of, I guess, just since we're in the context of emergency preparedness, I just want to mention that, folks can, approach emergency preparedness in terms of, medical solutions, and also non-pharmaceutical, medical solutions, and in terms including pharmaceuticals and so on, and also through non-pharmaceutical solutions like social distancing and masks and that kind of thing. And so Richard is going to kind of talk about, I guess, the full gamut of information solutions, and also give you a bunch of terrific resources. And Richard, we really appreciate you being here and pulling all this stuff together for us again. And so Richard is the acting communication team lead at the Immunization Services Division at the National Center for Immunization and Respiratory Diseases at CDC. And without further ado, Richard Corderone, take it away.
Great, thanks. And I am also really glad to be here. And I very much appreciate the partnership. I'm also very excited that the emergency preparedness component is the kind of overarching piece of this conversation. I was at one point in a previous lifetime, the acting director, deputy director of hospital preparedness and healthcare preparedness in Georgia during the H1N1 response and a lot of the planning leading up to that. So any opportunity to really kind of dig back into and reach really critical partners in that state and local planning and preparedness activity, I'm always very excited to do. So thanks for having me, and thanks for kind of keeping me in the loop. So next slide. So I'm going to talk a lot about, I'll go into really just kind of a disease surveillance update on COVID-19, flu, and RSV. We look at, just to really kind of set the stage and make sure we kind of all know what's going on in the background as we go into winter break for kids. And a lot of people traveling, a lot of opportunity to spread disease, and just kind of understand where we are now and think through kind of what the impact could be over the next 2-3 weeks and into the next month as well. And then I'm in immunization, so I'm going to talk probably more about vaccination than about some of the other interventions. But I do have, I'll definitely share some resources. And then we're really starting to revisit and dig into approaches to talking about vaccines and those clinical interactions. I did a talk yesterday for the CDC's COCA program, the clinician outreach and communication activity work, really looking at different ways to talk to patients about vaccines, and these the recommendations in there have some pretty broad implications for all parts of clinical practice. So it's an area that's evolving and really kind of needs to evolve as we sort of move from a post-emergency, post-pandemic space and begin thinking about that and what clinical practice is going to look like as we have this new vaccine incorporated into the vaccination schedule, and thinking about how we work that into our regular clinical practice. Next slide, please. So I will start out with just kind of looking at, and again, level setting where we are with respiratory illness overall. So the way that we track flu, way that we track a lot of these things every fall, winter, is we look at ILI, so influenza-like illness. And so we're really looking at it across the board as respiratory illness, and then we'll dig into it a little bit more with some surveillance testing that we'll do in order to differentiate, what type of viruses are circulating, what strains are circulating. So just looking at where we are now, and these are broken down into regular weeks of the year. So where we are now, you'll look over on the far left, you'll see that we're getting a lot more respiratory illness early. You guys are seeing this. This is not new, but you can also see, it looks like there might be a little bit of a dip starting. But at the same time, just kind of knowing that this is overall where we are with respiratory illness, that may not, that we may really need to kind of think about and be prepared for something a little bit longer. So next slide. So when these are data that just kind of show over the last couple of years, last year or two, really looking at where the peaks are and what's been happening with RSV. So the sort of percent positive, so these are people that might have RSV and whether they're tested. So this gives you an idea of kind of what's going on. But if you look at the purple line in both of these, you see sort of severity over sort of the same point we were at last year, and you see how quickly and how much higher the spikes are as we get into this fall and winter. At the same time, go back to if we're thinking about the previous slide, you're starting to see a little bit of a dip going down on the RSV side, which is very exciting, very positive. We're hoping that, right? So we're hoping that it's peaked, but when that dip's only going down a little bit. So even if something is peaking, and this is should be a lesson learned that we're absorbing from COVID response, that even if we've seen the peak and things are starting to go down, they're still pretty high. And there are other things going on that could burden the health system, burden our practices just as much going forward. So next slide, please. Which gets us to flu and where we are with activity. You can see the vast majority of the country is high or very high flu activity. So this is a subset of all the respiratory illness that we're seeing. If you've kind of watched the changes in this map, it started very much in the Southeast, was where we sort of had the earliest ILI activity, and you're seeing it spread now to more of the country, and possibly more or less populated areas. So you're getting that aggregate, but this really breaks it down by state. And so this goes out every week. We track it. So this is week 48, ended last week. So this is a little bit behind again. But as RSV is going down, we might be seeing flu or COVID disease going up, particularly in the younger population, in children, and then also in older adults. We're seeing a lot in nursing homes or long-term care settings, both flu and COVID related. Next slide. So this hopefully will be a blast from the past as well, but kind of looking at where we've had and points over the last couple of years where we've peaked and had different peaks in hospital admissions, so severe cases of COVID-19 that are requiring hospitalization. We're looking at it kind of these different peaks, and it's lower than it has been at other points in time where we've had pretty major upticks. But you see that this number is now starting to go up. And from the previous week, we had close to a 14% increase in COVID-19 hospitalizations. So again, we may be starting to see cases of RSV go down a little bit. But overall, we may have an indication that flu or COVID might be kind of starting to fill that void a little bit. And just to remind us that we need to stay vigilant. Next slide. So again, going into vaccination coverage. So this is our primary COVID-19 vaccine coverage by age. This is not a surprise with the perception, one, with vaccines being available to younger people later. We know that those numbers are going to be lower. But at the same time, the perception of risk of COVID-19 as an illness for younger folks is causing some challenges in this sort of and continuing to cause challenges, right? COVID is perceived as an older person's disease. And so the people who are getting vaccinated are the ones who perceive themselves to be in the most risk, even though, there's likelihood of children getting infected, spreading the disease, and how important that is to vaccinating younger and younger kids. Was on a talk yesterday where we talked about childhood immunization recommendations for the booster, and recommendations are complicated. So there's another component of this where walking through the recommendation can be really challenging and can be discouraging from that point of view of the vaccinator as well as the person getting vaccinated, because if it's not clear what the recommendations are, it's not going to be clear how to give those recommendations. Next slide. Bivalent booster follows a very similar trend, but at the same time, you see that people getting vaccinated with a bivalent booster, even among those that are 65 and older, that's an incredibly low percentage. And so there's a lot of work happening right now to get particularly the older adults vaccinated with the bivalent booster. And again, people have gotten, 3-4 shots, and, they're tired of getting poked, right? This is my father-in-law actually said this. I'm tired of getting poked, even though we're making sure that he gets the bivalent booster. But we know that the bivalent booster has protection against the current circulating strain, and that it also boosts the immune system from the original strain as well. So it's a really valuable, useful vaccine in protecting your friends and family as well as yourself. Next slide. So flu vaccination, we can see as well, just putting these two maps together, where we were last season. So 2023, I know that's next year, but it's the 2022-2023 flu season. So this is really kind of what we're looking at compared to where we were last season. And you can see that the vast majority of the country, their vaccination coverage levels for flu vaccination month to month, equal point in time is lower, just about in similar or lower in just about every state. So there's a lot of catching up to do in terms of increasing flu vaccination as well. So next slide. And again, even tells us a lot more, similar or lower in comparison with children as well. So the folks who are in the hospital, burdening are really kind of filling our health system. Kids are not getting the vaccine, the protection that would really help them make it through the next couple of months as we deal with the peak in the flu season. Next slide. So I do want to just kind of mention this. We're regularly surprised that folks don't know that you can give COVID-19 vaccine and other vaccines at the same time, and that we really recommend that because when you have a patient, you have them once sometimes, and you want to give them both vaccines and make sure that they do have the same protection. And there's no, all the data that we have show that there's no immunogenicity changes if you give them at the same time versus giving them separately. So really very much encourage people to, providers to give both vaccines at the same time when you have the patient in front of you, because both of these viruses are circulating quite heavily right now. Next slide. So we're going to talk a little bit about trust. Again, going back to the idea that relationships are the foundation of preparedness. And I really am excited about that opportunity to bring in more community health workers. When we're talking about it from just a very easy point of view of like, well, this will help with immunization or this will help with chronic disease, it helps create that connection to the health system overall. And it builds trust. It will increase vaccination. It will improve people's ability to change health behavior overall, because they're going to trust and have support from the health system, maybe in a way that they didn't have before. So big fan of community health workers and the role that they play in bridging between the health system and the communities. Because all this is about trust. And when we talk about vaccines and vaccine confidence, and this is a slide, if you've seen any of my talks, this is in all of my talks, because it's not only the vaccines and the providers, but it's every piece of the process. And with providers and vaccination being a really major point where people have that connection with the health system, that interaction really has to be positive for them to have an understanding of the larger system kind of being on their side or being supportive of them. Next slide. So to that end, we're really kind of looking at approaches to making recommendations and having vaccine conversations with your patients. And looking at it, we've talked in the past, we've talked about sort of taking a presumptive approach, using motivational interviewing, and really adding to this kind of a restorative piece, almost a trauma-informed piece to setting up and thinking about how you talk about vaccines and how you kind of welcome patients into your clinical environments. Next slide. So when we talk about a presumptive approach and a strong recommendation, we're really talking about, hey, make a very strong recommendation, taking this presumptive approach that assumes that the patient is going to choose to vaccinate, that they're not hesitant, don't sort of, and you reiterating that approach, that need, and saying that sort of multiple times throughout the clinical process. And that strong recommendation is probably the most important single part of ensuring that people get vaccinated when they come in for a clinic visit. Next slide. So when to use it. This is something that we're again really thinking about because there's so many touch points with the clinical setting. So everything from making an appointment. So what does either your online or your telephone conversation look like when you're setting it up? Reminding them, oh, hey, it says here that you're due for some vaccines. Just be ready for that when you come in. And then making sure that the staff throughout the clinic have very consistent messaging, and not literally the identical same thing that they're saying, but you know how one person frames or will put into their voice how to get across a strong recommendation and a presumptive approach to vaccination. So it really comes down to, you don't want anybody in the clinical process who's saying, oh yeah, you don't have to get vaccinated, or I don't get vaccinated, or they all only get vaccinated because they make me, which I've heard in my own clinical experience as a patient from different folks in different places. So knowing that, making sure that everybody in the clinic is on the same page, and that every touch point that a patient has, they're getting consistent recommendations, and putting this at the front of the clinical experience sets the tone and really kind of frames that conversation and the point of view. Doesn't have to be rude, doesn't have to be aggressive, just very clear and very direct about what to expect when you come in for a clinic visit. The same way if you're getting a specific test or looking for sort of a specific thing, you want them to be prepared. If you have to fast or you have to do something, it's part of that process. Next slide. And so the benefits, again, if you set it up, if you give them time, give people time to kind of know what they're coming into, this creates an opportunity, creates a level of trust, and creates that time to kind of think through it a little bit. So patients don't feel as though you're just kind of throwing something on them last minute. And we've seen across lots of vaccines, flu vaccine, HPV vaccine, that even those who would identify as hesitant or would be more reluctant to get vaccinated, or first-time patients, knowing all of that and having that presumptive approach, as opposed to a participatory approach where you sort of say, well, do you want to get vaccinated today? You're putting sort of undue pressure on the patient who is really not an expert in vaccination, but you're framing it from that point of view. And it opens up that dialogue. So if they do have concerns, this creates that opportunity for clinicians and community members, community health workers to address those concerns directly when they come in, and they're able to articulate those questions and go through it. And it makes the whole process a lot faster and reinforces trust, because those conversations that you have with patients really connect, again, this positive experience, someone that they trust in the process to really dispel and mitigate anything that they may have heard from the last 2 years of just misinformation circulating everywhere and being overwhelmed by it. Next slide. So when we talk about, as we get into, so now you've made this presumptive approach, and you're going to start asking questions and having those conversations. And we take a motivational interviewing approach. It's evidence-based, really based a lot on cultural sensitivity. It's based on the idea of you're empowering the patient, and you're not setting up black and whites. You're kind of working them through that process to help them make the decision. Next slide. So 4 steps, and it can take a minute or two. Just really being empathetic, asking permission to share information, have those conversations, and applying, really clear interviewing techniques to kind of navigate them through their thought processes. And then also, it's important to respond to the questions that you're asked. A lot of times the questions that were asked, I know this is the case for me, just kind of as a community member. I get asked the same question all the time, and same questions all the time. And usually they're absurd, at least in my mind, but this is the first time that somebody else has had that time to process through it. So being really thoughtful about it. Next slide. And as we think through, and this kind of blends all of these together, right? So you make a presumptive approach, somebody has questions, they don't know that they want to get vaccinated, you walk through the motivational interviewing process, and you take this restorative sort of trauma-informed approach. And it's a way to kind of engage people based on their histories with the health center, both personal and historical. I think this is an important piece of it. Here, I've heard a number of times, oh my gosh, Tuskegee, right? It's a very real thing, absolutely sort of core to the historical and personal foundation that some groups have with vaccination, with healthcare overall. The interesting thing about it is that we find that people want to give us more opportunity to fix it, to create that approach. But if they have a bad experience, it reinforces all of those historical problems and traumas that they're bringing with them. So they want that opportunity. They want people to trust. They want to improve their health. And if we give them that environment, that opportunity to do so, take that restorative approach, it would be very helpful. It would help them kind of connect and reinforce that trust in the system. You're going to have more engaged patients and more engaged healthcare environment. Next slide. So when we talk about this, and this information came from SAMHSA, we're talking about sort of creating a safe and trustworthy environment. So this is, again, taking the patient's point of view and creating that safe space for them in a very real sense, that place where they feel comfortable asking these questions, not rushing people through. And all these things are, just want to acknowledge, these are challenging. We're seeing more disease cases, probably have staffing challenges, and you're now giving more vaccines in more forms than you ever have before. So all of these different pieces are coming together. We very much appreciate the challenge that you guys have in that clinical setting, or even in that community setting where there are so many priorities that you're trying to address. But listening to people addressing their challenges, knowing what your point of view is, and being clear about those things, and just being empathetic, understanding, and empowering people to have a voice in the process will ultimately yield some really valuable outcomes, not just in vaccination, but in all aspects of health. Next slide. So all of these conversations in personal settings, professional settings help. Again, I think a lot of times we underestimate the value of that conversation that people have around the dinner table with their friends, with their family, knowing that anyone who works in healthcare is a subject matter expert for their friends and family. It's someone they trust. And so making sure that we're prepared, but also throughout our staff, they're prepared to have these conversations outside of a formal clinical setting. Next slide, please. So we have a ton of resources. These are just some links to some resources for ensuring that the clinical practice is strong, that you're doing all of the pieces of the recommendations, the storage and handling correct. But there's a lot more slides just kind of in the resources section here that have links to talking to patients, videos and scripts on how to institute some motivational interviewing techniques in an actual conversation, and just lots and lots of links like that. And if you see something missing, please let us know. Hopefully we're working on developing it. And I'll say, even me who works for CDC, I miss sometime that I forget sometimes that we have a resource that's really awesome, and sometimes I miss when resources are updated. So please when the slides go out, take a look at those links and share them, use them, give us feedback. Really appreciate it. Thank you. Next slide. And I will, after this, hand it over to Martha to really talk about what's happening with RSV and the working with a disease that doesn't have a vaccine and some of the unique challenges of that. So thank you.
Well, thank you so much, Richard, for the opportunity to really co-present with you. It's always great to really partner with our HUD and other partners in health and human services today. I want to say thank you, and especially for those of you that are here with us, thanking you for taking the time to be here with us, because you could have chosen to do something else, but you're here to participate in this conference. So my focus today is really to reflect and discuss with you why RSV is important for children, and also to think about what you can do in public housing in order to protect children as well as their families who are in public housing or using public housing resources. Next slide, please. So if you think about RSV and why it is important in early childhood, there are a couple of reasons, but before I start, I wanted to build on the idea that we are talking about emergency preparedness, right? Because the reason behind emergency preparedness is to enable all of you to plan and to anticipate risks that may come, whether it is outbreak or other issues that are related, especially in the health arena, and then plan on how to reduce harm to you, to your family, loved ones, to children, or in the housing unit, in the community where you are. With the idea of this preparedness is so that you are well prepared to either reduce the injuries or to prevent it from happening, in the infection from actually happening to your loved ones. So RSV is important because it infects mostly children before they are 2 years old. And then you may have incidents where there are repeat infections that could happen when people are older, but especially when it impacts children at the older stage. It could be because of exposure, or it could be adults that have certain medical conditions. An example of medical conditions that actually make people to be more vulnerable to get RSV include children that are premature infants, or children that have congenital heart or chronic lung disease, or just young kids that may have compromised immune system, or it may be adults that also have compromised immune system, or older adults. Next slide, please. So as a parent, I wanted to really focus on 3 different audiences: parents, and then people that are in the community, housing community units. And my third audience will be people in the health care setting. So for parents, there are a couple of things that I would like you to bear in mind. And that is one, RSV is common. I know right now everybody, most parents are anxious because we are still in COVID, although it's tapering down with the COVID virus, the variants, the new mutants. At the same time, we have RSV, and then we have flu. So with this triple-demic kind of effects, parents are worried. But I want parents to know that, RSV is common. It's just that the other confluence of factors, or that like COVID as well as the flu elevates RSV now in such a way that people are concerned. I also want you to know there is a link where you can have access to information as a parent. And there are a couple of things you can think about doing. One is making sure that your kids and yourself and your loved ones are not spending time around someone who is sick. Like someone you can see that are sick, they are blowing their nose, they are really coughing, they are shivering. You see all those symptoms. Try to keep your children away from that person. Have your children to wear masks. Remember what we learned from COVID. Wash the hands of your kids 20 seconds, each time. Just make sure that their hands are clean and your hands are clean. And then disinfect if you're not in a place where there is soap and water. And make sure you watch the kids if they are touching surfaces that are frequently touched, like doorknobs, or even like we're in holiday, you're going to a store and they're holding on the rail as you're going on escalator. Just take hand sanitizer, wipe down the kids' hands, and then cover our coughs. We know how to do that. And then if you have tissue, use even tissue and dump it in a trash. Next one. And then for housing, public housing partners, there are a couple of things I also would like you to really consider. One is to think about the parents, the families living in your housing units as critical partners for you. They are your hands and your feet. They can be champions. Even as you partner with community health centers, negotiate with community health centers about making the parents to be like health champions or outreach within your public housing, because they are the ones that are the trusted messengers. They are the ones that the colleagues will actually listen to and understand as they talk about trying to influence people to go get vaccination for COVID, for flu, or to really embark on any of these prevention actions and that we're talking about. Another partner you may have will be youth, that you can even do something that is exciting for youth, have youth health champions in your unit. They can give themselves a name, feel empowered, and that will also be an exposure and changing the culture. Have posters on RSV, posters on flu. There are similar symptoms and exposure to these outbreaks. So have posters that will help people to know what to do. Put pamphlets, flyers, email everyone in your residence to have this information. Distribute masks, hand sanitizers, tissues, and especially make sure there is clean, disinfected surfaces in the public housing units, like doorknobs, like all the mobile devices, or even the rail elevators, if you have one, or staircase. Another one is control density, because we are now in a holiday mood when we are gathering, either to have a session or things like that. Reduce the time that people are there. If people are sick, you can move it outdoor. Just things to really potentially control the spread will be very important. Lastly, collaborate with healthcare partners. Have on-site flu shots, on-site COVID vaccine shots, have community outreach or health event, living healthy, let's say in the name of your housing, and make it an event that will engage everyone so that you're also building awareness at the same time. Next slide, please. At the end, I just want us to have some time for questions. So the key summary tips for people to just bear in mind is, remember, prevention works. Yes, we have high incidence of RSV going on now, and you heard from my colleague, Richard, that is tapering down. But considering that we have not even gotten into the peak winter season, we all need to be on guard and diligent. Go back to the safety tips that you all use during periods of high COVID activity, social distancing and all of those things, masking, sanitizing, just go back to it. Remember, if your children, for parents, have minor symptoms of cold, try to manage it as you normally do without getting worried. But if it is not a minor symptoms or light cold symptoms, please talk to your healthcare providers even before giving your child non-prescription cold medicine, because there may be agents in the medication, even though it's non-prescribed, that may be harmful to your child. The last thing is drink water, keep the children well hydrated. Thank you, and I'll turn it over to Bob.
All right, Martha, thank you very much for all that great information, and Richard as well. We've got a few minutes for Q&A. So to the audience, if you have questions, please put them in the chat. And if you'd like to, speak up, just, raise your hand. And in the meantime, I'm just going to make one quick point. I mean, Martha, you were talking about events and that kind of thing. And I mentioned earlier that HRSA had some funds that they were putting into expanding COVID vaccine. And I talked to a health center and housing agency in the Northeast just yesterday, and actually they are planning next week to do kind of a winter carnival, winter festival kind of event, which they're sponsoring, and they'll have some stuff for the kids and so on. And at that time, they're also going to do COVID and flu vaccines as well. So it seems like a great utilization of the resource and a great way to kind of bring the community together. I guess since we don't have too much time, I did want to ask kind of one question to Richard, and that is about the whole triple-demic issue and the issue of, how do the three viruses occurring simultaneously impact folks? Are people going to catch all three? Are they going to catch one and not the other two? How is that going to work? And how do people prepare for that?
So you had asked me to follow up on that before, and so I think it's going to be based on previous year's data. So you've seen one flu season, but there's indication that really in and I'll say there's also an MMWR coming out tomorrow, has this information in it.
Richard, do you want to just say what an MMWR is?
Yeah, so it's the Morbidity and Mortality Weekly Report. So this is a weekly report to highlight and have a scientific process, a peer review process to put information out in a fairly short period of time. So it comes out once a week, and it consolidates a lot of CDC surveillance and findings over the course of that week. So it's the study that's coming out sort of showed last year that we're looking at about a 5% or so of patients diagnosed with one condition, flu or COVID, had a co-infection with the other. So it's probably pretty unlikely, but enough of a likelihood that clinicians should be aware of it and really kind of think through what the potential, somebody who does have test positive for both and has pretty bad clinical symptoms, like which route to go and how to handle antiviral or monoclonal antibodies and work through that process. And I Jason kind of post something in the chat about sort of clinical management in long-term care settings, particularly nursing home and more congregate types of settings. So there's a lot of potential clinical considerations to work through. Definitely that gives you a guide as a place to start, but I'm sure clinicians will have some questions and really want to work through it specifically to the patients that they're treating.
And in last year at this time, you couldn't find a COVID test. And this year, I think they're pretty plentiful. How about testing for flu and RSV?
So one thing I did notice a couple of weeks ago is that our number of flu tests, rapid tests, is like double what it's ever been in previous years. So we're seeing doctors, clinicians are using flu tests more to differentiate between, what might be flu or might be COVID or might be RSV, or might be, another respiratory illness. So so our clinicians are really using them as a clinical tool to help guide their process of treating patients and make sure that patients are getting the treatment that they need.
And in preparation, we talked at the beginning about preparedness. And preparedness, emergency preparedness, people think of initially natural disasters. And then on the other end, people think of active shooter kind of emergencies. But in the middle are, outbreaks of infectious disease. And of course, there's been nothing probably that's impacted more people in the last couple of years than COVID. And during that period, there were some things that people did and who were, I guess, more successful had done in advance. They had a telemedicine program. They had, they had generators, or they had a communications plan or a work at home plan for staff. They had tents. They had PPE, protective equipment for staff and stuff. And as you guys kind of look at this, because it seems like these kinds of outbreaks may be with us for a while, how do health centers and housing agencies, the different work environments and the different missions they have, how do they prepare? What kinds of things should they do? What kind of things should they have on hand? What kind of plans should they have in place? Any thoughts, Richard, from your side across the board, and Martha with respect to kids and RSV?
So I'll just kind of start broadly. I think a lot of that needs to be revisited, right? I think the last 2 years gave us this understanding of what continuity of operations looks like, and the value of sort of different things like stockpiling, different types of equipment and supplies, and what's really needed. And even understanding, the change in supply chain, just that we're dealing with right now, that's different than it was in 2019, for example, and buffering for a change in supply chain, buffering for that situation where you might have a lot of staff out sick at one time, and being prepared to kind of navigate around that, and knowing that people need to take care of their families. And I think, we've part of, one of the reasons that maybe we're seeing a, decline in, the number of people leaving the healthcare profession, and just, people retiring, challenges with that, we do have to set up a situation and ensure that we're protecting our staff and giving our staff the ability to take care of their family. And so looking at it through that lens, and knowing that we have a lot more flexibility than we realize. There are a lot of things that we did differently that worked really well, particularly in a surge, right? And knowing that there are going to be surges of different things at different times. We're in a vaccine surge right now. We've got a number of kids that need to be updated for their routine vaccinations, right? So knowing that, this is not a endpoint, oh my gosh, we're just going to go back to normal, but we're going to be kind of in a surge state for a while, and knowing that that's like a new baseline, at least, probably for, definitely for a few months.
Well said, Richard.
And probably longer. So knowing those different things and approaching your planning from that perspective, I think is helpful, and probably just the right place to start, and then going through and questioning those different pieces of your plans.
Very good. Thanks, Richard. Martha?
Thanks, Richard. I just wanted to say to everyone, remember that mostly informal network was what we depended upon. And we shouldn't allow those families and people in the community that we depended upon to just go back. There is a new normal. So what I will encourage everyone is always stockpile those things that people need on a daily basis, and make them available. And mostly think about your delivery service. Just swip the switch, right? Think about your delivery service to be the community instead of the health center. So the housing unit, just flip that switch quickly, because the community should be the center point, not really the clinical, so that we can actually be the one to learn from the people and figure out how best to engage the people to move on prevention and then access early intervention in order for us to be well. Again, flip the switch. The clinic shouldn't be the center, but the community. Thank you.
Excellent point. Both health centers and housing agencies are out there for the residents, not the other way around. So that's a great point. And right now, our great friend Jason Amarhaji has put in the chat the SurveyMonkey evaluation, and we ask you to please go to that link and complete the evaluation. As I said, it really helps us in kind of planning for the next one and to identify what you guys really need. And also it helps us kind of justify what we're doing. So I hope you enjoyed the session. I'm gonna go to Jason and let him kind of close us out with the last word. So Jason, go ahead.
Great. Thanks, Bob. Thanks, everyone, for joining us today. And I know that folks asked about this, so we are going to provide the deck, and there are some slides here in the back, in addition, from Richard and CDC around being a trusted messenger, building off of what Martha was talking about. If you have a role in the community to get any information out, or you work with folks who do, this could be a great resource. So thanks to all of our speakers. Thanks especially to all of you. I know we're going into the new year, 3 years now from the start of the pandemic, and a lot of folks are eager to move on from COVID and even things that have been with us for a while, like flu and RSV. So we want to make sure that we can continue to deliver content about health that is useful to you. So please do fill out that evaluation. Let us know what you're interested in hearing more about, as we look to provide more content next year in areas like mental health that we've heard from you all are just as important as the pandemic response. But most of all, we hope you all have a safe and healthy holiday season, and that this has been a useful resource to help avoid any illness or surge in your community or in your families. And we look forward to having you join us next year. Thanks so much to all of our presenters for being here today, and we'll see you in the new year.
All right. Thanks, everybody. Take care.
Thank you. Happy
Bye.
holidays.
That concludes our conference. Thank you for using Event Services. You may now disconnect.